Hi, this is Terry Kuti with Deep Sea Foundation. We are here in Chicago at Plastic Surgery The Meeting 2018, and I have the honor and privilege of talking to Dr. Scott Hollenbeck from Duke University. And today he's going to talk about one of the challenges that plastic surgeons, in particular microsurgeons, face when they have certain patients with a higher BMI. I'm going to let him take over. He's going to give you all the details on this. It's important information that I think viewers should watch, and a lot of good discussion you could have at your consult. So Dr. Hollenbeck, thanks for joining us today.
Yeah, thanks, Terry. First, I want to say congratulations to you and all the work you've done, and the fact that our society has recognized that. I think you provide a tremendous service for patients, and I'm happy to be a part of this.
Oh, thank you.
Sure.
Thank you very much. It makes me happy.
What I'm going to talk about is a very difficult topic, but I feel it's important to talk about, and that is breast reconstruction. Patients that have an elevated BMI or have extra weight. It's very common, as we know, and it's a difficult discussion to have with the patient as well as all those involved, the family, the referring surgeons. But I think if I highlight some things in the next couple minutes that may be helpful, it may help people understand the frame of reference in which we can work in to be a little bit more constructive and hopeful, and eventually get to where we want, which is a satisfied patient with a long-term durable result that they're pleased with. And so it really starts with the kind of the definitions, and that is BMI, which is body mass index, which is a way in which you can sort of divide individuals up based on the calculation of their BMI. And that's done by the World Health Organization, and they have a table, and sort of the big cutoff points there are 25, which is considered overweight, BMI 30, which is considered obese, and then it breaks into class 1, 2, and 3, which is up to BMI of 35, and then BMI of 40. And that's the sort of target that I like to talk about, is the patients with the BMI above 35 to 40. And the challenge is that doing the reconstruction is, first of all, it's difficult when a patient has a lot of extra weight. But I think more important is the frame of reference that when the patient gets a diagnosis of breast cancer, many times they often want to do everything possible to improve their health. And it's sort of a reawakening of the idea of, hey, I need to do everything I can. And patients will sometimes change their diets, change environmental things that they're around. And so I like to think of weight management in the same kind of context. And really what we're going for is a patient to get down to a certain target. And for me, I like a body mass index of 35 or below. And it's not exact science for everyone. Some patients have a BMI of 35 and they're shaped a lot different than another patient with the same BMI. So by no means is it an exact science, but more of a guideline.
Because everybody has different body habitus.
Yes.
It's not just the BMI.
Exactly.
Yeah,
and that plays a big part into how we do the flap reconstruction. And I think that the main advantage is that it's been shown in many, many studies that the higher the BMI a patient has, the more at risk they are for breast cancer recurrence. And at the end of the day, that is the most important thing. And to me, that is what we need to focus on. Even when a patient presents to discuss reconstruction, is hey, let's really, really work on getting your weight down, because it's going to really benefit you long term. The other big aspect is, as I mentioned earlier, the actual reconstruction itself tends to come out and work a lot better when a patient has actually lost some weight, when they're up at that higher BMI range. And what I mean by that is when you do the flap procedures, deep flap included, you're removing a portion of tissue and then moving it to another spot, and it's very difficult sometimes to get a natural looking result when a patient is at their highest weight they've ever been in their life. Instead, when a patient has lost maybe 15 or 20 pounds, or sometimes even up to 50 pounds to get to that target goal, we're able to take the extra skin that remains and really use that to tighten everything up and do the reconstruction with plenty of available tissue still. And the patients that undergo that process tend to be very, very happy. And at the end of the day, again, they've gotten their weight back to a level that we feel is going to be way more healthy for them in all regards, including their breast cancer diagnosis. So that's kind of a brief overview on weight management. As I said, is extremely difficult, but I try to focus the patient on their own health and taking back their own health, and I try to be there with them for that. So to meet every several months and let's see how you're doing, and we can plot it out, and we set a very specific goal. And I can make referrals to dietitians, referrals to weight loss centers for patients that may be candidates for quite a bit of weight loss. But we work together as a team. And when that happens, and I can be a coach or a motivator to help with that, I'm just very pleased, and have had many patients tell me just how happy they are that they really took that on and did that. So that's my particular opinion about that. It's highly variable. You can talk to other surgeons who believe there should be really no weight cutoff or anything. And it can be very difficult for patients when you turn them away from reconstruction. It probably is the most difficult aspect in my whole practice, but I hope what I've shared with you today has helped at least provide some insight into that decision making.
So my takeaway from this, Dr. Hollenbeck, especially being here at the meeting this week, I think as a patient advocate, we try to connect the dots between you guys and the patients. We come in with a breast cancer diagnosis, very difficult, but I'm sitting here listening to you talk about the fact you have to be a motivator for weight loss so there are better outcomes with the breast cancer patient. That's not an easy task to do.
No.
And so to be able to be here and to talk to you guys about some of the challenges you face, we know what challenges we face. I think it's very valuable for the viewer to know there are folks like you that really have the patient's outcomes, emotional interest, all of that tied together. This has been valuable information for me.
Good. Well, I hope so. And what I would tell people that are struggling with this is to just keep at it and really try to change the whole, perhaps if it's the right thing for you, change the whole frame of reference in which you're looking at your health, and view it as a way in which you're going to get a lot more out of the surgery. The results of the surgery are just so much better for patients that have been able to successfully lose some weight coming into the surgery that are up at that high weight limit, you will reap the benefits from that. And there's no question about it. Also, we didn't talk about this, but briefly, we know that surgical complications are much more likely in patients that have the higher BMI. That's been shown in many studies in many fields. And so just, again, even to think about it in a very selfish way, think about it as, hey, I am going to put myself at extra risk if I go through with the surgery now, but if I can get down 20 pounds or so, my chances of having these complications, that is usually infection and wound breakdown, are going to be better. And the surgery, as I said, just works a lot better. And at the end of the day, it's all about long-term health. And so I hope I've been able to illustrate that without being offensive to anyone. I know this is a very delicate topic, but I thought it was valuable to share at least my insights into that.
I think it's these tough topics that we have to tackle and to verbalize them and talk about them. So thank you so much. Not only are you eliminating the cancer, you're also helping them to improve their health. You've got a double plate there to handle. Big challenge, but thank you so much for sharing that information.
It's my pleasure. And again, thank you for everything you do for patients and now as part of our society, and we've recognized that. Again, want to say thank you on our behalf as well.
Thank you so much. I really appreciate it. All right. Thank you.
Okay.